Another social problem that is humanitarian induced is the overcrowding. The homes are destroyed. People have very little place for safety and shelter. So you have a lot of people in shelters. There is overcrowding. At this time, privacy is not important. People are just focusing on their safety and getting shelter above their head. Okay, and also undermining community support. When we look at the mental health problems, pre-existing mental health problems, persons will have problems like depression, schizophrenia, or some persons will be using harmful substances. Imagine with a disaster, what are some mental problems that can be induced as a result of the disaster? Grief, especially because people have loss, they have loss of family, loss of their livelihood. So they will definitely have the experience in grief. People have acute stress reactions where they, because of the traumatic event, and where, during a traumatic event, people feel overwhelmed. They feel so overwhelmed, and most times they feel like their life is threatened. And person will be experiencing stress as a result of this. Also, people will increase their use of harmful substances like alcohol and other illicit drugs. Persons who did not suffer from depression before will end up suffering from things like depression, anxiety, post traumatic stress disorder. What are some of the mental problems that are humanitarian induced? We could have things like anxiety from lack of information about how to get food or to access basic services. You well imagine at that time, people are worried. People are worried about the uncertainty of what's going to happen. Will there be communication to the outside world so that people will know what's happening with us and so that they can help us? How are we going to be able to feed ourselves? How are we going to feed our children? Will we get food in time? So these are some of the humanitarian response and mental health problems that we'll find. Also, we have problems obtaining mental health services. So, pre existing, normally we know that there is limited access to quality, affordable mental health care, where the normally the need is much greater than the resources that we have available to take care of those needs. This normally exists. And you can well imagine with an emergency or a catastrophe, this is going to be even less, where you will have staff shortage. You'll also have things like this disruption in the medicine supply chains, damage of facilities, and again, the demand will be much higher for mental health care. Remember, I said earlier that over 90% of persons will have psychological distress, right? So you can well imagine and know that some people will have a new, they'll be diagnosed newly with mental illnesses like anxiety, like depression, etc. So this is going to definitely impact on the mental health need that persons will have. Also, we have the humanitarian response in these um, problems where you have lack of coordination and insufficient training for emergency responders. That is a serious problem post a disaster where there will be so much disorganization, things are not coordinated. So what you would normally expect to get, there will be a break in it, there will be a disruption in it. And at that time, persons will be scrambling trying to see how they can even try to obtain some kind of training so that they can produce some emergency relief, psychological relief. So you can see at that time, to try to do this at that time, it's going to be insufficient. Okay? And these are some of the problems that we have when we have these emergencies and catastrophes. So, what are some of the recommendations? The one of the recommendation is the mental MHPSS, mental health and psychosocial support, and this is recommended in all sectoral emergency preparedness plans, not only in the health sector but in all the sectors, including hazard and vulnerability assessment, capacity building plans, and coordinating mechanisms and contingency plans. These are some of the recommendations to assist in the disruption that occur whenever there is a catastrophe or an emergency. Also, another recommendation is to establish a cross-sectorial MHPSS technical working group. In other words, a group that is there to coordinate the activities so that things will be more organized. Everyone will not just be doing what they want, how they want. There is a center that knows exactly what is happening, and then they can determine who goes where, and that will be, things will be so much more organized and things will get done in a better way. Another recommendation is to strengthen community self-help and social supports involving vulnerable groups and people with mental health conditions. An important recommendation is the orientation of frontline workers in psychological first aid to provide emotional and practical support to persons. This is so important. And I remember here in Dominica, it was just before Maria, we did a training on psychological first aid in the primary healthcare setting where over 200 people were trained in psychological first aid. And shortly after, we had Maria. And these people who actually they became instrumental in providing that emotional support for persons around Dominica after this time. So psychological first aid is another a very important recommendation. Important also is to offer clinical mental health care in the general health facilities and care like the MHGAP training, that's the intervention guide. And most of you would remember just sometime last year, we had the MHGAP training for healthcare workers. And that again was done in order to better equip the non specialized medical personnel in being more comfortable in assessing, diagnosing, and treating persons with mental health conditions. This also was done within the community setting. It was done in the Kalinago territory, where we to go into the community and train persons in being able to identify the core symptoms of persons with mental illnesses, providing support to their family, helping them in rehabilitation, and after being able to determine who requires further intervention and where they can work closely with doctors and the nurses in the primary healthcare setting so that persons who have mental health conditions will receive treatment much earlier. So this is another important recommendation. Another one is to we need to remember at all times we need to protect, promote the rights of persons with mental health conditions. A lot of times this is overlooked. So we have to remember no matter what, and especially in times of emergency, persons will not pay much attention to this, but we should never forget that it's important to protect and promote the rights of persons with mental illnesses. Another important recommendation is having a referral network so that there will be a clear guideline as to how referrals can be moved from the mental health specialists to the general healthcare providers, the community supporters, and anybody who is relevant in the service. So if this happens, there will be so much more organization. There will be less duplication of tasks, etc. Okay, so this is just the overview of this time, the World Mental Health Day, and what the themes about this year. Thank you very much.
Thank you very much, Dr. Wallace. And you could well imagine the discussions on the media houses throughout the week is geared towards unraveling all of this information, bits and pieces, so that persons can better make meaning of it. Yeah. All right. So at this time, we will invite Dr. Newton. He's one of our house officers at the unit, and she's going to be speaking to us on working with people affected by disaster events.
Thank you, Mr. Boran, and good morning to everyone. Okay, so good morning again. And this morning I'll be elaborating on the challenges that we often face as healthcare professionals, as well as the persons who are affected by disaster events. So, oftentimes, persons are faced with anxiety, and we are to be able to identify what are the symptoms of anxiety. Persons often complain of having palpitations, meaning a racing heart. They're often breathless, restless, irritable, tearful. Some persons might even be numb and not experience any emotions at all. They may have trouble concentrating or persistent negative thoughts about themselves and even the world around them. They may have sleep problems and even become withdrawn socially, meaning withdraw themselves. They stop interacting with others, family members, friends, co workers. Now, distress. All of us, I think after Hurricane Maria, all of us were distressed. All of us suffered distress. Distress is often associated with injury, loss, illness. Okay, and when I speak of loss, I mean loss of human life. Okay, loss of property. We often face with grief, and the grief basically for those who may have lost loved ones. There's a loss of income, there's housing instability, food insecurity, childcare issues, and in cases of disease outbreaks, social distancing or quarantine to prevent the spread of infection. So there's often changes in social support as well as socializing. I think all of us have been through all of the issues that I've identified here. It's not anything new to us. Now we are going to look at ways that these challenges might affect people with existing mental health issues. So persons who already suffer from depression, anxiety, schizophrenia, or bipolar disorder. So various mental health conditions. Disaster events have been associated with post-traumatic stress disorder or post-traumatic stress symptoms. And when we speak of post-traumatic stress symptoms, I'm going to identify what it is that we expect persons to basically manifest. In that case, we often basically we relive the disaster basically by having flashbacks and nightmares, sleep disturbances because of the events. Persons oftentimes try to avoid the triggers associated with the events. Now, persons are often sometimes on the edge. They often experience negative thoughts about themselves. They have intrusive thoughts. They're often hypervigilant, always on the lookout, being easily startled, and even have sleep problems. So these are the post-traumatic stress symptoms that we have to look out for in ourselves sometimes, and even in family members after a disaster event. Persons are often frustrated. They can be angry. Now, financial loss has been shown to be associated with serious distress. And basically puts us at risk for negative psychosocial symptoms such as anger and anxiety. Having to depend on families or family members for financial support has been particularly shown to be difficult as it puts us at risk of having conflict in the family, depression, as well as post-traumatic stress disorder. We are going to look at ways to mitigate risk for persons in our care. How do we mitigate the risk? How do we lessen the risk for various mental health conditions for family members, for our friends, our children, our partners, and our community members? What do we do? So we have to check in on them regularly, check in on our family, our friends, our co-workers, check in on them regularly. The support is very important. We have to provide accurate and up-to-date information related to the event. We have to empathize with, their stress reactions. We have to listen actively to whatever it is that they experience or to the person's experience. We have to validate their emotions by showing that we understand their perspective. We understand what it is that they have gone through or what they are going through. We have to foster their ability to cope with stress. And we are to convey to them that they can make meaningful steps to manage their stress reactions. And the meaningful ways we can convey to them that information is by educating them on various stress relieving techniques. Okay, how to cope with stress in situations like this, disaster events or catastrophes, or even emergencies. Okay, in the event of an outbreak, etc. What do we do to relieve our stress? We should be able to identify emotional triggers, what it is that triggers us emotionally as human beings. We can employ different breathing techniques to manage our stress, exercise. We can journal our experience in the time of disaster. And we should not be afraid of seeking professional support if we constantly feel overwhelmed. We always encourage persons to seek professional support because at times we cannot do it on our own. We often need help. Now, I'm going to look at how to talk about disaster events. Now, we as mental health providers, we have to be well trained to help manage and to help others to manage their distress. So we are going to look at the tips for providing care in the context of disaster events. We have to stay informed at all times during the disaster events so that we have the most up-to-date and reliable information to share with others. We are to address the current context, meaning the disaster event itself, and tailor our treatment based on the specific context as well as the stress reactions at each contact with each individual. By taking a person-centered approach, you can avoid making assumptions about how the person is reacting. Example, people who are inclined to take preventative measures during disasters or prior to disasters, they often feel validated and often feel resilient, whereas others may experience negative reactions based on a variety of perceived stressors, okay, such as disagreement with recommended or imposed limitations on their activities. And we saw that a lot basically during the COVID-19 pandemic. There was a lot of restriction basically on our activities, our ability to socialize, to move around freely how we wanted, even with the curfews. And that brought a lot of distress for persons, and persons reacted negatively to a lot of the restrictions. Okay? So a very important thing that we have to identify is we should never assume that someone is reacting to whatever it is that's happening around them. They might be reacting to something else that happened earlier on. So we have to be careful in making assumptions of a person's reactions. Now, insufficient physical, financial, or emotional resources, or even preparedness efforts. We have to have potential reminders. Oh, sorry. The disaster itself can manifest basically as potential reminders of past traumas or losses. So you losing a loved one during a disaster, it could pose as a potential reminder of your previous losses, whether it's friends or families, etc. There's often extended restriction of work or leisure or social activities. There's loss of health, especially during disease outbreaks, loss of income, loss of resources, loss of family members or friends, and even our normal routine. Okay, so there are various considerations that we have to look into when modifying our treatment. Okay, now when we think of treatment, we often think about medications, we often think about pharmacological treatment, but here we're speaking about psychological treatment. Okay, be careful not to assume that the people you are working with are having the same reactions to the situations that you are. Everybody reacts to stress in various ways because all of us we have different coping mechanisms, okay, or different ways of coping with stress. So the way that you might react to a disaster, it might not be the way that I might react. So we cannot assume that everybody's reacting to an event the same way as us. If you decide to move forward with an existing treatment mode, consider discussing potential modifications that map more closely onto your patient's current challenges. These modifications will be very specific to individual treatments. So you treat a person based on whatever it is that they need or whatever it is that is affecting them at the moment. That is in context of providing prolonged exposure, for example, during a pandemic. For example, you would not recommend that someone expose themselves to crowds while the Center for Disease Control has recommended social distancing. Okay, and this would be during disaster events. This would be a great time to network with colleagues and see how they adapt in their treatments, what it is that's working for them and what it is that's not working for them. You yourself can help others through the successes of others. Okay, so there are various skills that are provided online for psychological recovery field operations. So there's actually a guide that you can use online. It's called Psychological Recovery Field Operations Guide. And it offers additional strategies for teaching simple disaster related coping skills that have been found to be related to better recovery from adverse events. It may also be appropriate to spend time discussing how the skills the persons have been learning in their existing treatments can be helpful in managing their reactions. For instance, you might say, let's take some time to apply the strategies that we've been practicing to your reactions related to what's going on now. Before we get started today, I just want to check in on you to see how you are doing in the context of the event. Since we've last spoken, what are the biggest stressors for you right now? What is helping you to cope with the current situation? Given what you've just told me, let's talk about what makes sense for you right now. We could stay focused on our current course of treatment or stop the treatment for a bit and focus fully on helping you manage your reactions you are having right now related to the disaster. I don't want us to lose progress but we have been making so far. But I want to make sure that we are helping you in the best way that we can. We could also take a break for a session or two and focus on new skills that you could use. Then come back to the specific treatment. And what do you think might be most helpful? So these are things that all of us can employ when we are faced with disaster events. It's not only for us, the mental health providers, but we can employ these things in our family setting, with our friends and with our employees. Thank you so much.
Thank you, Dr. Nathan,
You're welcome.
for this presentation. We'll now move on to our next presenter, Mr. Dave Loda. He's a psychiatric social worker. He will be presenting on mental health and psychosocial support in emergencies for children. So, Loda.
Thank you, Dr. Wallace. Um, as Dr. Wallace highlighted, my brief contribution here will explore mental health and the psychosocial support during emergencies. The focus really is on children, and you could well imagine as mental health care providers that mental illness favors young people, right? And that is because the young mind is impressionable and can be easily affected by the trauma experience. So during emergencies, during catastrophe events, the persons who are most likely to be impacted negatively would be the younger ones, rather than the older ones who are already mature in their minds, right? So the focus here is on the children. There are some general facts that I want to outline. Children, they are frequently exposed to conflict, natural disasters, and other humanitarian crises, which leads to severe psychological and social consequences. Millions of children around the world suffer unthinkable distress due to armed conflict, natural disasters, and other humanitarian emergencies. Children are often forced to flee their homes. They are separated from their parents and caregivers during catastrophes. They endure staggering violence, severe injuries, and sexual exploitation. They're often cut off from fundamental services like clean water, healthcare, and education. And often children lack access to mental health and psychosocial support with potentially devastating long term effects. These are some general facts to remember. We therefore examine what results or what do you have happening if there's a lack of the mental health services and social support among children, right? And often anxiety is a key one, depression and other stress related problems threaten the children's ability to grow up healthy and happy. They have lifelong toll on their emotional health, physical health, and the social development. And if children are exposed early, the experience can hamper even their brain development. For adolescents, when exposed to catastrophe or emergencies, that can cause the adolescents to resort to alcohol and drug abuse, result in low self-esteem, health issues, poor school performance, as well as it would push them in becoming suicidal or self-harm, all right, injuring themselves. There's the agency of the United Nations called UNICEF, United Nations Children Fund. That agency is dedicated to the protecting of the rights and welfare of children and adolescents worldwide, especially during times of disaster, during times of emergencies, during times of catastrophe. UNICEF was established in 1946 and it provides aid to children in emergencies and works to secure long term access to essential services like health, nutrition, education, water, and sanitation. I'm therefore going to look at three categories of persons um, that UNICEF caters for during times of catastrophe or emergencies. The children and adolescents. UNICEF says is good at setting up spaces that provide regular, structured activities to help children and adolescents develop skills to deal with crisis, solve the problems, regulate their emotions, and form and maintain relationships. And this could be through peer to peer groups, recreational activities, sports, life skills, and vocational training. This agency also works to address harmful behaviors and norms in order to reduce bullying, abuse, neglect, exploitation, and violence. And also, UNICEF provides direct individual support to refer children to specialized care. For the caregivers and families, UNICEF develops the knowledge, they work towards developing the knowledge and skills to support children in distress. They raise awareness of the distress reactions that children may have during humanitarian crisis. And that is a very important one because the signs are always there when children experience trauma. The signs are there, but are we trained to identify the signs? Very often the signs are not seen at home, although it is there, but are seen more often in the school setting where persons are more trained to notice and identify them. All right? UNICEF provides positive parenting skills, knowledge, and skills. They train persons or parents and caregivers in supporting children with mental health conditions, strengthen family and community support networks, facilitate the inclusion and participation of vulnerable families in communal activities, and promote peer support groups for mothers and fathers. And for caregivers and families, also UNICEF work towards psychological first aid, parent education programs, peer support groups, and specialized care to parents and caregivers with mental health issues. The last category is communities and partners. UNICEF works along community organizations to develop capacity to support child and family well-being through stigma reduction campaigns, programs that facilitate mental health care, and also provide clear information about children's mental health and psychosocial needs to help communities take action. All right, so just in conclusion here, catastrophes, emergency do have impact on children, communities, caregivers, parents, systems in our society must be trained to identify the reactions that will be coming out of the kids and to work with the kids to help them navigate through the stresses or the negative impacts that these catastrophes can have on them. At the end of the day, what you want is to preserve the mental well being of our kids during periods of catastrophes and emergencies. Thank you.
Thank you very much, Mr. Loda, for this presentation.
Yes. Thank you, Dr. Wallace, for passing back to me. All right. So next presenter is Dr. Wallace herself. She's coming back. All right. She's going to be speaking on the common reactions and responses to disaster, how to cope, essentially. Dr. Wallace.
All right. Thanks, Mr. Loda. So, again, we need to remember that in times of disaster and catastrophes, as I said earlier, persons will have psychological reactions, right? Now, it's very important to understand those reactions and recognize them as normal responses. And if persons recognize this and they understand where they are coming from, it will be easier for them to cope with them. Okay? So that's one. Secondly, we have to remember that the disasters, they are normally unexpected, they are normally sudden, and they are normally overwhelming. And generally, you may not have any outward visible signs of physical injury, but you will have the emotional turmoil. You'll have impairment you'll have this emotional turmoil and you'll have the psychological distress. Now, the immediate reaction to a disaster or a catastrophe is one of disorientation. You're feeling totally stunned, where you are unable to integrate distressing information. You remember that, right? I remembered it. I remember it. I had that very same reaction, where I was totally disoriented after Maria, and I remember coming here to meet the rest of the team so that we could go out and mobilize ourselves to provide psychosocial support to the rest of Dominicans. And for about a week, none of us could do anything because we ourselves were impacted by this. and we were still experiencing those emotions. We're humans too, right? Even if we are trained in providing the support. But yes, it happened, and it took a team from Trinidad who visited to come in here and actually do a debriefing with us. And after this happened, we were then able to go out and provide the psychosocial support to the rest of Dominicans. Okay? So these are some of these reactions, they are real. And the more we can identify with them, the more we know about them, it's easier it's going to be for us to navigate through them and to help us to cope with those distresses. Some of the common reactions, persons will experience a change in their thoughts and their behavior patterns, where a lot of times they'll be responding to the vivid memories that they have, sometimes for no apparent reason, but subconsciously it is there, and they will have the reaction. Dr. Newton spoke of some of the physical reactions and the palpitations, poor concentration, etc. Difficulty making decisions. She spoke of the sleep and the eating patterns, where some people will sleep more, eat more, or the opposite, where they'll sleep less, eat less, right? So you can have these reactions occurring at different times and in different ways. Persons will have sensitivity to a lot of the environmental factors, where they'll be reacting to sirens, they'll be reacting to loud noises. Sometimes when you have fires, and they'll be reacting to burning smells or any other sensation. Even animals react. I remember after Maria, dogs and cats, they were reacting to noises. Whenever they'll hear we had thunder, they'll run and hide. So it affects everybody. Um, so those, and what happens is that when you hear those songs, they will stimulate the memories of the disaster, and they'll cause people to have a heightened sense of anxiety and feel very fearful that there will be another event similar to the one that was experienced. Persons will have strained interpersonal relationships, where there'll be increased conflict among family members, where you'll have more frequent disagreements. Some and family members, co-workers, sometimes you may not even be able to understand where it's coming from. But it's happened, and that's because you are still reacting subconsciously to the tension that you're experiencing. Dr. Newton spoke of being withdrawn and being isolated, and again, I will not go into the physical symptoms, but what also happened is that persons with pre-existing medical conditions, they also could be affected by the disaster-related stress. Persons will have intense or unpredictable feelings, where they will feel suddenly anxious or grief stricken, and people will have very irritable mood, even more moody than before. Now, let's focus now on how do you cope with those reactions. I will first establish that most people are resilient, and they are able to bounce back within a few weeks or a few months. Most people are. It's very few, as I said, who will develop mental conditions, mental disorders. And we have to remember too that the reaction for everyone varies. We have to focus on the person's personality. We have to focus on the person's past experiences. We have to focus on whether they have any underlying conditions that could predispose them to having those reactions, or even mental illnesses. We have to focus on their mindset. How do they normally cope with stressors? And we have to remember to, at those times, and we need to let people know that what worked for you in the past will also work for you right now. So you need to try to, go back in your archive, try to remember back when I had something similar to this. What did I do? What helped me? It helped me before, it should be able to help me again. So they can use these very same mechanisms. It's important also to give yourself time to adjust. Allow yourself to mourn for the losses, because as we mentioned, we established before, there are loss of livelihood, we have loss of loved ones, and persons, it's normal to mourn when you lose something that is important to you. So you need to allow yourself to mourn. Allow it. In fact, if it doesn't happen, this will be abnormal. Okay?
Also, you need to ask for support from people who care about you and who will listen and empathize with your situation. Support is key. It's extremely important, be it from family members, be it from friends, be it from other people who survived disaster like you, because they experience the same thing. So it will be easier for them to identify with what you're speaking about. So it's important to remember that. Also, persons who were not involved in the disaster, they may also be able to provide support because they may have more objectivity. Because they were not there, it would be easier for them to be more objective and not focus so much on the emotional and subjective aspect of themselves, and they'll be able to be of much more help to you. It's just important the person has to be willing to listen. If the person is not, they will be of no help to you. Okay? Communicate your experiences. Some people don't like to speak. Some people don't like to communicate their distress. They keep everything inside and they don't say anything to anyone. But it's important that you express your feeling in ways that are comfortable to you. Guess what? You have a distressing situation, you have this turmoil going on, and you keep it to yourself, you say nothing else to anyone, 100% of the problem is yours because you're not sharing it. You share it with somebody else, suddenly that person has 50%, you have 50%. So it's important to communicate your experiences with others, your family, your friends. Sometimes even nonverbal communication may assist you, where you may either keep a diary or you may engage in creative activities like drawing, etc. That also makes a difference. Important also is to find a local support group, but a group that is led by trained and experienced professionals. Remember, I said trained and experienced because whoever you communicate with has to be someone who can help you. Do not communicate with someone who is not going to use the information that was communicated to them to work in your interests. And some persons, they may actually cause more harm than help you if they don't know exactly what it is that they're doing. Group discussion is important because again, it helps you to realize that you're not alone in your reactions, that there are other people who experience the very same thing like you. I cannot stress the importance of engaging in healthy behaviors where you eat in a well balanced diet, getting sufficient rest. Important, if you're not able to sleep, try to engage in some relaxation techniques. Important also is to avoid the alcohol and the other illicit substances. Yes, they may numb you and they may divert your attention to something else, but then when they wear out, it comes right back. And not only that, by you using this, it's going to cause other problems for you. Okay, so it's not really going to help you. Important too is to establish or re establish routines where you eat meals at regular times, where you sleep at particular times to try to regulate your sleep cycle, also following a rigid exercise program. Try to build in positive routines. For example, pursuing a hobby, walking, going for walks, reading a good book, etc. And another important thing to remember is at those times, do not engage in life changing experiences, decisions like that. Do not exchange in decisions that are going to change your life. And I remember what Mr. Loda reminded me yesterday after Maria. A lot of people did that where when they woke up and they saw the destruction that they suffered, they just pack up, they take whatever the most important documents and they left Dominica. They moved away with no intention at all of ever coming back because they were just so overwhelmed by the destruction. People didn't see how they were able to bounce back, how they were able to move and to start living a normal life again. But at this time, you're experiencing this distress. So it's not the best time for you to make life changing experiences like that. A lot of these people, they are actually regretting that they made those decisions. Okay, so it's just to show you that those times you need to avoid making those major decisions. Okay, thank you very much. Mhm.
Thank you very much, Dr. Wallace. We have our last presenter, Dr. Giss, learned and able. Doctor. She's going to be speaking on warning signs of emotional distress and managing stress in children. Yeah, just shift it. Okay.
Okay, thank you, Mr. Loda, and good morning again to everybody. As Mr. Loda said, I will be speaking about the warning signs of emotional distress and managing stress in children. Now, it is very common to feel symptoms of stress before and after a crisis because disasters, emergencies, and catastrophes can have a devastating impact on our lives because they sometimes result in physical injury, harm, damage, and even destruction to property, loss of family members, loved ones, loss of our homes, and even our business places, our places of employment. And therefore, this can definitely impact us in some way. Um, However, most stressful symptoms are temporary and can resolve on their own. However, for some people, it takes a longer period of time that lasts sometimes even weeks or months, especially in at risk populations like the elderly, children, people who already suffer from mental illnesses, and also people who suffer from chronic illnesses. And so these can also affect their relationships within their family and friends. Now we're going to look at some of the warning signs, and it's very similar to what my colleagues have already spoken of before. But however, we want to keep in mind that if you start to realize these things post a crisis or disaster, you would want to, you know, make note of it and try to seek help if you need to. And these may include eating or sleeping too much or too little. You can be feeling angry for no reason, feeling edgy, or just lashing out at others, feeling overwhelming sadness, or pulling away from people and the things that you previously used to enjoy. Also, not connecting with others. You can feel a lack of energy, always feeling tired and exhausted, or sometimes even just mental exhaustion. Feeling like you have to keep busy, antsy, preoccupied, having unexplained aches and pains, sometimes constant stomach aches, headaches, and chest pains. You can also feel a sense of helplessness or hopelessness. Excessive smoking, drinking, and using drugs, including prescribed drugs as well. You can take note of that. Also, worrying a lot of the time and feeling guilty, but you're not even sure why you're feeling guilty. Also, if you start thinking of hurting yourself, killing yourself, or doing that same thing to other people, and also having difficulty just readjusting to home or work life. So, these are the kinds of things that we want to keep in mind and take note of and realize that, hey, something is going on with me. I'm maybe not dealing with this situation as well as I think. So now we're going to look at managing the stress of children after a disaster, and this is targeted to the caretakers, the guardians, and parents of these children, because when children are exposed to destruction, disaster, or even death, it will definitely impact them in a negative way, and then so we have to first of all ensure their safety, their physical safety and security because that takes priority. However, the aftermath of these situations can be difficult for children to cope with. And so, as their caretakers and parents, it is up to us or you to provide and to help manage these these stresses and reactions that the children are having. And therefore, as caretakers and parents, guardians, you want to discuss your own reactions with another adult first before speaking to your children, because your response to the disaster is going to affect your child's response. So, therefore, just like Dr. Wallace was mentioning, the Trinidadian team had to come to help them cope first before they could go and help others. And it's the same for children. Because if you come into your child to speak about a disaster and you yourself, you're unsettled, you're still stunned and shattered, that is going to affect your child's response. Also, you should make time to be available for your child, just to talk or just to spend time together. Sorry. Every child has a different way of responding to trauma, and we need to remember that. It is not advisable to require the same response of everyone. So sometimes you may say, okay, so the neighbor's child the next morning was outside playing with the dogs. However, my child is inside or not willing to get out of bed. We have to understand that everybody, even adults, respond to trauma differently, and so it is the same in children. So you have to be patient with your children and listen to their own stories. Discuss the event in an open and honest manner with your children, because children might want to talk intermittently, so you just have to be patient again and take time. And younger children might need concrete information to be repeated to them. So also you want to be knowledgeable of what is going on and have concrete information to share with them. And then they just want to understand. So they may be asking a lot of questions, and they might ask the same question over and over. And so again, just be patient and repeat the information as much as possible so that they can understand. You also want to be just generally be available for your child. Engage them in conversations of their choosing and not necessarily about their feelings or of the event itself. Okay, so that they can feel a little more comfortable. Maintain daily routines and familiar schedules as much as possible, such as attending school when it is reopened, or establishing family time, or even bedtime stories. Also, limit the times of exposure to television and other sources of information about the disaster and its victims, because you don't really want the child being exposed to seeing pictures of people, bloody pictures, or all of the destruction and everything that is going on the outside, because that can also affect them, cause them to get nightmares, etc. Also, you want to increase your child's sense of control and mastery within the household. So, therefore, let them help to plan dinner or even prepare dinner, and let them give them an input in planning the day's activities. Even if their suggestion is let us play a game or color or do something like that. So, you involve them in planning activities, and also ensure that whatever suggestion they make, you make it a priority so that it actually does happen, so that they can feel a sense of control and therefore not really focus on everything else that is going on around them. You want to reassure your children that the disaster was not their fault in any way, because children have a way of personalizing things and making it and believing that things that happen that they have no control over as their fault. And so you want to help to reassure your child that anything that happened was not their fault. Also, remember the older children and the adolescents, help them to understand their behavior and their reactions, and help them to set limits, because they themselves may be impacted as well. Also, you want to tolerate your children and be patient with them and understand that they may return to any old behaviors that they may have exhibited before, or like they would regret. So for example, they may go back to wetting the bed or not being able to sleep alone anymore. And so you have to help them through these times all over again. Also, you want to provide concrete information to your child about how they differ from the other people in the disaster event, or people who were more severely impacted and affected than they will, to decrease over identifying, to decrease them over identifying with victims. So you want to help them to highlight the positives that in their own situation compared to what they're seeing on the outside. And so these are the different ways, small ways, that as a caretaker, as a parent, as a guardian, you are going to help your child to manage stress, because we cannot always wait for when the psychiatric team gets to your home. You are the one going to be with your child in the situation and right after the situation, so you can start with just these little guidelines as to helping them to manage their stress. Thank you.
Excellent. Thank you very much, Doc. Well, that brings an end to the presentations, and I'm going to allow Dr. Wallace the final word to just summarize everything.
Thank you. Thank you, Mr. Yoda. So we've started our week of campaign, the week of activities, and we've had the church service already. This is we're having the media briefing right now. We look forward to the rest of the activities, and especially the media campaign where we'll be going on the various media houses and really raising awareness and spreading um, and educating persons on the theme. Educating persons on the theme. Access to service, mental health in catastrophes and emergencies. And during this, in spreading this information, we will be focusing again on the natural catastrophes, the human crises that continue to disturb the lives of persons globally. And especially, even with all this rubble, we will still find that mental health treatment is still one of the most ignored and underfunded aspect of emergency response. So the World Federation of Mental Health right now, they're really emphasizing the critical need for long-term mental health care, where they're calling on the government, they're calling on NGOs, they're calling on the health system to prioritize mental health care and see it as an essential component of disaster planning and recovery. They are advocating for integration of mental health into emergency response frameworks. They also advocating for training of frontline workers in psychological first aid. They're advocating for investment in long-term recovery and trauma-informed care. And most importantly, during this World Mental Health Day week of activity, we will be we'll be calling we're calling for persons to act, and we want them to remember that mental health is a necessity. It is not a luxury. Okay, thank you.